Good evening. My name is Grady White, and this is NSG6020 Advanced Health Assessment, the final health assessment for this class. I've washed my hands, and first, thank you for being my subject in this health assessment. So I've washed my hands. I'm going to kind of look generally at your skin condition. Okay. Let's start with your head and your face. I'm just going to inspect your hair and your scalp. Showing to see how it's looking. Okay, if you can wrinkle your forehead for me. Close your eyes. Close your eyes while I'm pulling up on that. Okay. Puff your cheeks. Okay, and clench your teeth. And I'm assessing for symmetry. Okay, I'm going to palpate your temporal artery on your forehead. Okay, it's present. All right. And now, open and close your mouth. Okay, and now move your jaw side to side. Okay. And I'm going to push down in your chin. Don't let me do it. I guess resistance. Okay, I'm going to push up. Do it. Okay. And I'm going to palpate your sinuses on your eyebrows. Just let me know if there's any tenderness. Any tenderness with that? Okay. And your maxillary. Any tenderness?
No.
Okay. And we have tested the Snellen acuity test, and she has 20/20 vision. All right, we're going to do. We're going to test confrontation of your eyes. If you can cover your left eye with your left hand, please. Let me know when my fingers come into view.
No. No. No.
And just look straight ahead of my nose.
No.
And switch right hand, right eye.
No. 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 No.
Okay. Good. All right, and follow. Just keep your head straight forward and follow your eyes. Follow my finger with your eyes. I'm going to go through the 6 cardinal positions. Okay. Good. Alright, so if you can, I'm going to check out your conjunctiva in your eyes. They provide protection to your eyes. And check out the conjunctiva, the sclera, which is the white outer part of the eye, the cornea, and the iris, which determines the color of the eye. And what I'm checking for is symmetry and any discoloration from normal. Right now we're going to check. We're going to test, see if the pupils are round, reactive to light, and accommodating. Just stay or look correctly at me. Okay. The pupil is dilated on both sides appropriately. Alright, now we're going to move on to the ears. We're going to inspect the external ear. Any tenderness. Okay. Any tenderness when I approach that?
Mm-mm.
Okay. And we performed the whisper test, and the forced whisper hearing test was passed bilaterally at 5 feet. I'm going to move now to the nose. We inspect the external nose for symmetry, position, proportion, and lesions. And can you blow through your nostril? Okay. And the other one? Okay. And nostrils are patent bilaterally. We're going to move to the mouth and throat. We're going to use a flashlight and inspect the buccal mucosa, the teeth, and the gums, tonsils for symmetry, and for any abnormal signs. Okay. And the gag reflex can be determined by swallowing, which tests the nerves that control the gag reflex, as well as putting a blunt instrument on the soft palate, and that'll also give rise to the gag reflex. And we're also checking, whenever she just said, oh, we're checking to make sure the tongue was midline and without tremors. Okay, next we're going to move to the neck. Alright, we're going to palpate the lymph nodes of the neck, the interior cervical nodes at the sterno and the SCM muscle. Okay. Any tenderness? Okay. And the posterior cervical nodes, which are along the trapezius muscle. Okay. The posterior cervical nodes along the sternocleidomastoid muscle back here. And lastly, the supraclavicular right above the shoulder. Any tenderness?
No.
Okay. Alright. Next is the carotid pulse, one side at a time. Okay, and that's present bilaterally. We're going to listen for bruise. Okay. And the trachea is midline. Alright. We're going to test the range of motion of the neck. So if you can put your neck forward and back, and then move your shoulder to your ear on that side and this side. There you go. And your chin, if you can move it side to side. Okay. I'm going to test your muscle strength against resistance. If you can shrug your shoulders for me. There you go. And move that way. Move that way. There you go. Oh, and okay, move forward and back. Okay. Any tenderness or pain this time? Okay. All right. We're going to move on to the back of the patient. We inspect the posterior chest, the thoracic cage, skin characteristics, symmetry of the shoulders and muscles. We're going to palpate for any lumps or masses. Any tenderness?
No.
Okay. Now we're going to palpate, or no, percuss the costovertebral angle, which is used to rule out pyelonephritis. So right here, any tenderness?
No.
Okay. And then we'll listen to the breath sounds bilaterally at the upper lower lobes. And deep breath. Okay. Deep breath. Okay. Deep breath. Deep breath. And deep breath. Alright. Okay, we're going to move to the front of the patient and look at the way she's breathing and the skin characteristics to make sure everything is uniform. And we're going to listen to the lungs in the front. Deep breath. No. Deep breath. No. Deep breath. No. Deep breath. Right. And we're going to listen to the cardiac bass with the patient leaning forward. Okay, deep breath and exhale. Okay. And we're going to check that. I did not hear a murmur on that. We're going to check the upper extremities, hands and the nails for shape and color, consistency. Okay, we're going to check the joints and the wrists and the hands. We're going to check for a capillary refill. Okay, and that's less than 2 seconds. Immediate capillary refill. And skin temperature is warm and dry. And we'll check the radial and brachial pulses. Okay, same bilaterally. And the epitrochlear lymph nodes. Which, if those are inflamed, the forearm will be swollen. All right, and we're going to check your shoulders for range of motion. If you can flex your shoulders forward and back, okay, and then up and that back down. And we're going to check your shoulders against the resistance. If you can move them up like this. Don't let me, there you go. Out. Any tenderness or pain? Okay. We're going to check your muscle strength to your wrists and your hand grasp. So if you can grab my fingers, okay, and then hold your wrists like that, or hands like that, and move up and then down, okay. And any pain? Okay. All right. We're going to check your neck muscles now, and suggested head of bed up 30 to 45 degrees. Let's see. Can you look that way for me? All right. You're just looking at your carotid artery and look that direction for me. Okay. Now we're going to move on to the heart. We're going to inspect the precordium for pulsations and heave, and we're going to note if any abnormal thrill or apical impulse is detectable. All right, we're going to listen. We're going to look at the